And welcome to Alzheimer's Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
All right, here we go. What you think about, you will bring about.
Well, hi, everyone, and welcome to Alzheimer's Speaks Radio. I'm your host, Lori LeBay, and I'm thrilled you can join us today. We're going to be talking about the connection between dementia and stem cell therapy. Can it really help? What does it do? And we've got our expert today, Dr. Joy Kong, with us, and I'm going to introduce her in just a moment. But we're always getting new listeners, and so for those of you that are new to our show, Alzheimer's Speaks is about sound information, not just sound bites. Our goal is to raise all voices, big and small, around the world, from those diagnosed to those that care and serve them, to advocates, researchers, and so much more. Now, today we are a live show, and so you can call in if you'd like at 323-870-4602, 323-870-4602. We just ask that you kind of stay topic specific with us if you've got a question, and of course that you are respectful. And you know, we've been doing this since 2011, and we just haven't had a problem with that. It's fun to hear what people have to say and the questions that arise, and usually if you're thinking of it, someone else is as well. So know that we're here to answer your questions if we can. So 323-870-4602. Now, Alzheimer's Speaks has updated its website, and please check that out. We've made it really simple to find all of our free resources. There's one page that holds them all, so you can find out about radio shows, you know, our past archives, to dementia chats where we facilitate conversations with people living with the disease, to people wanting to open up memory cafes or maybe becoming dementia friendly. You can access Dementia Map, which is your roadmap to care. We've got Dementia in the Arts, free tools and products, a poetry section, and so much more. So please feel free to check that out. You are also going to want to check out Saltbox TV. If you haven't heard of them, it's a wonderful free online streaming platform that was designed specifically for seniors. They have some of their own curated programs along with lots of educational stuff, plus old TV shows and movies, etc. So check out Saltbox TV. And if you're interested in a support group, I do offer a couple. One is Arthur's Memory Cafe, which we do virtually on the second and fourth Wednesday at 1 p.m. Central, so that would be 2 o'clock Eastern Time, noon Mountain Time, and 11 a.m. Pacific Time. And also the Caregiver Connected Group meets the fourth Wednesday of the month, and that is at 10 a.m., and that meets at Shoreview Community Center here in Minnesota. And we also offer respite care, so you can bring your loved one there too. Just email me at radio@Alzheimer's Speaks, and I'll get you that information. And then coming up, Art of Senior Living is sponsoring a program I'm doing on September 20th from 6:30 to 7:30 Eastern Time. That's going to focus on the realities of dementia. And it's all going to really be about family-friendly tips and tools. So please feel free to join us there. And if you're in Minnesota, I'm going to be doing a screening with the Minnetonka Dementia Friendly group October 31st. And that is going to be a screening of A Timeless Love, which is really such a powerful, powerful film. We are going to hear from the adaptive adaptive equipment and caregiving corner, and then we'll be right back to introduce you to our guests and get into this discussion about stem cell therapy.
I love the footbar walker, and let me tell you why. It is the option for my toolbox that I've been waiting for. Let's be honest. There are some clients who, despite our best rehab efforts, just aren't able to return to performing a sit-to-stand transfer on their own. Now I can offer my caregivers an easier, safer option that doesn't involve hoisting their loved one up from a sitting position. I don't recommend this walker for all of my clients, but I do recommend this walker for those caregivers looking for an easier, safer option with transfers. I would also encourage other therapists to add this walker to their toolbox. It's kind of like having my own mobile parallel bars for the client to pull up on. Whether it's a family caregiver at home helping a loved one with Parkinson's or dementia, CNAs in a long-term care facility assisting their patients, or therapists adapting to client and caregiver-specific needs, we now have a very safe and effective option to offer in the footbar walker. Check this product out at thefootbarwalker.com. That's it for today from Adaptive Equipment and Caregiving Corner. Have a great day, and don't forget, if you can't do it, adapt it.
Well, we are back, and it's time to introduce you to Dr. Joy Kong, who is a triple board-certified physician in the fields of psychiatry, addiction medicine, and anti-aging and regenerative medicine. She was named Top Doctor of the Year in stem cell therapy in 2019. Also named Empowered Woman of the Year in 2019, and Stem Cell Doctor of the Decade in 2021. And she's also written a memoir, Tiger of Beijing, that was named Book of the Year in 2020. So this is one busy lady, and I can't wait to have a conversation with her. She is also the founder of Uplyft Longevity Center, which is located in California, where she really focuses her efforts on preventative aging as well as chronic disease that no one has really been able to heal. Dr. Kong believes in complete healing, and that can only come from looking at the whole person, body, mind, and soul. And this has really allowed her to address the root cause of many health issues and help lead her patients to a fuller and more vibrant life. Well, welcome, Dr. Kong. I'm so excited to have you with us today.
Thank you so much, Lori. I'm really happy to be here. I just think you're doing some incredible, needed work, and really appreciate the opportunity.
Well, I have a family history. My mom lived with dementia for 30 years, and I didn't see myself in this space at all. I was very content in residential real estate, but sometimes things just knock at your door or kind of blow your house over, and it just changes your perspective and things land. So given that, I'm wondering, have you been personally touched at all in your family or circle of friends by dementia?
Not my family, not so much. Of course, my grandma at much older age, in her, late 80s, there's dementia going on. But definitely I've just in my clinical practice have dealt a lot with dementia patients, and I worked at the VA for 4 years, and we actually have a geriatric ward. There are a lot of dementia patients. So, a funny story, when I was there, the attending is a neuropsychiatry physician. So I was, very excited about excuse me, all the, all the science behind brain care. And he was super excited about the direction of Alzheimer's treatment. And he was telling me that, Joy, this is about 2006, is that in 10 years, we'll have a cure on Alzheimer's because the government has put in $10 billion and we're going to get a cure. So he was going to conferences every year, waiting for that cure. And it just, that just shows you how wrongly, like we are targeting, the wrong targets when the search for a cure. I think Alzheimer's is a lot more complex. than what people anticipated. I think we're still trying to understand the etiology. The metabolic issues is a huge component, inflammation, brain, neuroinflammation, all the amyloid, the plaques. That may very much just be a marker of the downstream, effect of the real root causes. So, and then there are people who believe that there's viral origin in triggering Alzheimer's or a lot of other diseases. So I think we're still trying to figure out very much, in the beginning. But we do understand some mechanisms of how Alzheimer's happens, which is why that some of the therapies can be helpful, including stem cell therapy.
Yeah, I agree with you. I think there's, I always refer to this as a baby disease. It's been around 100 years, but, in terms of life lived, that's a very minute number. And there's so much to learn in so many different variables in terms of dementia that are cropping up all the time. It's been really, really interesting to watch the research and also really frustrating when people are saying, 5 years, it'll be here in 5 years. And we don't seem to be a whole lot closer, with things at this point. Why don't we talk about stem cell therapy? What is it? And well, let's just start there. What the heck is it for our audience, if you can kind of break it down?
Yeah, so stem cell therapy is just so exciting because, if we trace back where stem cells come from, that's really where we came from. We all came from one single fertilized egg, and that's our first, the grandmother stem cell, and that produced us. That's a pretty incredible statement, just thinking what might be in that one cell that can produce an entire complex sophisticated human being, right, or any other life on Earth. So the cells have certain intelligence that direct itself to divide, differentiate, involute, forming 3D structures, and then, somehow all these organs work seamlessly together. So that's the kind of intelligence that we're trying to harness. And we're still in the beginning of stem cell therapy, but we are making some inroads. One of the powerful cell types that we're utilizing is called mesenchymal stem cells. And there are a lot of different stem cells. Just to give you a quick overview, when the fertilized egg is trying to divide, initially, all these cells, a lot of these cells, especially inside the embryonic sac, the cells are all considered pluripotent stem cells. So you can take any one of those cells, and then they can grow into a full human being. And that's where embryonic stem cells, that phrase came from. It's from these cells that are tremendously powerful. And that's only day 5 to 7 of fertilization. But we don't use those these days as far as clinical utilization. That's pretty much only in the research arena. What we use clinically is more developed stem cells from an adult source. An adult actually includes a newborn baby. So embryologically speaking, they are an adult. They're fully formed human. So even though they're 0 day old, they are still considered an adult. And we're utilizing either the birth tissue, which is the same age as a baby, or from a person's own. And we're obtaining various cell types actually from these extractions. That can include mesenchymal stem cells. And these are the cells that usually hover around blood vessels all over your body. So anywhere you have blood supply, you will have these mesenchymal stem cells. So, some Dr. Kaplan, who discovered them, really doesn't want them to be considered to be called mesenchymal stem cells because he said they're not the quintessential stem cells. What they do is a whole medicinal signaling property. So they're actually coordinating this regenerative activity in the body because they sense what's going on in the blood and they sense what's going on in the local tissue. And because of that, they can figure out what to secrete locally to the local tissue, including local stem cells. or versus transporting themselves, squeezing into the blood vessel and swim upstream to find where the problem is. So this is one major cell type that we're utilizing in the current stem cell therapy. I'm sure 10, 20 years from now, there's going to be, a whole different cell type, but right now this is the best we have. And there are also hematopoietic progenitor cells that are mostly in the bone marrow, also circulating in the cord blood. There's higher amounts. There are other progenitor cells, immature immune cells. So you can use all these populations because as the baby develops, the cells keep dividing and differentiating, which means when they differentiate, they're gaining new functions. They're also losing certain potentials that instead of being able to become cells of all three, layers of, three different cell types, they may only, able to become, one cell type. So they lose potentials, but they gain function. So we can utilize a collection of these cells depending on what tissue source you're using. So that's kind of the quick overview of what these stem cells are. And it's more complex than what people think.
Mm-hmm. Well, I remember never hearing about them until Christopher Reeves, who played Superman, was in that accident, and him being such an advocate for stem cell research. I knew nothing about it, and I still know very, very little, other than I'm hearing a lot more talk and a lot of different ways that stem cells are being talked about being used. And so, now that it's kind of stepping into the dementia arena, I know ears are really perking up, needless to say, in this community. What has, I'm going to sneeze here, and I'm sorry because when I sneeze, it's just kind of out of the blue. And I'm not one that has control over it, so excuse me ahead of time, folks, if you hear a large sneeze. Anyways, I'm wondering with dementia, you've seen it for, and heard about it for, repairing, skin cells and all different types of things. What made people think that it could do something, for the brain? And I'm putting this really, really simply because our audience really varies, and I'm very simple-minded as well. So I'm right there with your audience. But it just seems like it's such a big disease versus maybe healing a wrinkle or something on your skin. They just seem in two totally different calibers there. So I'm wondering if you can kind of explain to us in terms of stem cells, and maybe you did and I just didn't grasp it, how it can work in such a broad fashion.
Yeah, so maybe I'll go into the main mechanisms of how stem cells work. Mainly, I'll focus on mesenchymal stem cells, but there are other stem cell types too, and then I'll come back into Alzheimer's. So just a quick overview of what these mesenchymal stem cells can do, since they are kind of the conductor in the symphony of regeneration, right? They're the orchestrator, and they have anti-inflammatory effect, hugely anti-inflammatory. So they can calm inflammation. Of course, we know aging is an inflammatory condition. That's why there's a phrase of inflammaging, because the aging and inflammation are so tightly tied in together. So it can calm inflammation. So if you keep it being inflamed, it's really impossible for your body to regenerate. Inflammation is important, but if you continue to be inflamed, then you're not going to regenerate. And then these stem cells can also have immune modulating properties. So with people who have, as we grow older, there's more and more autoimmune issues. Our immune system is declining, it's, getting older and less effective, and autoimmune diseases are, becoming just, there's more prevalence. And a lot of the inflammation is because your body, cannot really change itself to a more anti-inflammatory environment. So these cells are able to shift the immune system to a more anti-inflammatory state, so modulating the immune function. And then it has anti-fibrotic properties, so it can break down scar tissue. I mean, I've injected patients with like Pebrase, directly into the penis, and the penis straightened right away, within within a couple of weeks. I mean, it breaks down the scar tissue. It's pretty amazing, treating people with COPD and getting them off oxygen. I mean, and getting off almost all the medications because they are, the fibrosis is broken down. So antifibrotic, very powerful, very interesting. And liver cirrhosis patients, had really great success. And then they have angiogenic properties. So promoting the formation of new blood vessels, low oxygen hypoxia, it's, low blood flow is the, part of the contributing factors to a lot of chronic diseases and poor healing. So that can be very powerful. You can regenerate cells, but you also need blood supply, right? You can't have cells without nutrients and removing toxic byproducts. And then these cells have direct antimicrobial properties. Very interesting. They can secrete antimicrobial peptides directly. And they also have what's called pro-apoptotic properties, so pro-programmed cell death. So they promote programmed cell death in senescent cells and in cancerous cells. So these abnormal cells, they can detect, especially when the cells are younger. This is why I'm a big proponent of using younger cells when possible. So birth tissue cells are the youngest we can use without any ethical, dilemmas. They are way more potent at detecting cancer and abnormal cells and trigger them to go into programmed cell death. And they also, on the other hand, have anti-apoptotic properties, so against programmed cell death, because if you have certain injuries, and sometimes the injured cells will send signals to make neighboring cells go on this, pathway of death because of the cascade, the molecules that trigger the CAT cells are actually able to stop that kind of pathway and reverse the process, so they can save cells in the neighborhood. Like when you have a mechanical, like crush injury, or you have radiation injury, you have a stroke. So the cells that are fully damaged in the center of the injury is dead. But a lot of times you end up getting a lot more damage. So stem cells can go in and protect that. So you can see there's like this wide range of benefits, but also they can talk to local stem cells. So let's say your liver, it can talk to liver stem cells, how the liver stem cells to go ahead and differentiate. Not necessarily that the MSCs, the mesenchymal stem cells themselves to differentiate, but they are able to tell the cells in the tissue to differentiate and form new cells for that tissue. So these are mesenchymal stem cells. Of course, we have hematopoietic progenitor cells that can form cells in the whole, that constitute our blood. There are endothelial progenitor cells that can help form new, vascular lining. So every tissue, there are more specific stem cells. So then I want to come back to Alzheimer's. Really, you have to look at what causes the Alzheimer's condition, right? Since we don't know exactly, we can only see what's the outcome, what may be involved. So one thing that's found is that there's decreased circulating stem cells. Like this study in particular is hematopoietic progenitor cells, so it's hematopoietic stem cells. The Alzheimer's patients have less of these stem cells circulating. And what's interesting is that we know the brain can regenerate itself, but that kind of regeneration decreases with age. And one reason is because there's less and less circulating stem cells. The stem cells from the blood, the hematopoietic stem cells, can actually differentiate into neuronal and glial cells, so supporting cells. So they're actually able to become neural cells, right, or cells in the nervous system. But there's less and less of these circulating cells. But in Alzheimer's patients, there's even less compared to people who don't have it, right, to normal brains. So that could be one of the potential mechanisms. If we can replace some of these really important cells that can promote neuroregeneration, then we can help the brain to regenerate, to heal. I was talking about how there's more animal studies than human studies right now, partially because it's difficult to, look at, amyloid plaque formation, in the human brain. You have to wait until autopsy. So, but they could do animal studies where they have mice models of Alzheimer's disease, And they were able to show by series of low-dose infusions of the umbilical cord blood cells into the mice with the Alzheimer's-like disease, they were able to reduce the amyloid plaque presence by 62%. And then there's another marker called cerebral amyloid angiopathy. So this, blood vessel pathology, we were able to reduce that by 86%. So that's pretty astonishing. So the hypothesis is that it's so helpful because it's targeting the inflammatory response that is central to Alzheimer's disease and also other neurodegenerative conditions. And then I was talking about a human study where they were able to treat these patients with that have the average age of 73 years of age, and they were giving them stem cell treatments, and then they followed them at 3 months after and 6 months after. So 3 months after, they saw a significant improvement in people's mental cognition, cognitive capabilities. So using, certain testing. And, but at 6 months, it went back to kind of their baseline. So I think this illustrates why it's important that I kind of insist when people have a serious medical condition, be it, neurological, neurodegenerative, or other chronic conditions, it's important to do a series of treatments because the cells only live in your body for about 1 to 3 months, and their effect, including all the growth factors and exosomes they secrete, that will exert benefit for another 3 months. But there's they don't live forever because no cells, when you activate them, is going to live forever. I mean, we don't live forever. And when you put the cells in the human body and in a very inflammatory state, like in an Alzheimer's patient's body, in the body and in the brain, these cells will receive, they will try to fight inflammation for you. In the process, they can also be destroyed by the inflammation because the inflammation is very toxic to their own cells and cells you infuse. So they have an attrition rate. That's why you want to give another treatment to build on the success of the previous one instead of letting the kind of the underlying mechanism to take over again, to drag the person back to where they were. So of course, even for this study, 6 months later, the person was back to baseline, so they didn't decline. So maybe that's, that's a victory. I mean, that's the best current medications are able to do, which is to keep you at baseline for as long as possible. So there's nothing that's going to reverse and improve your cognition, whereas something like stem cells is able to improve, which is very much encouraging. So I think a series of 3 treatments, at least for somebody with Alzheimer's, spaced 1 to 2 months apart, that's a good regimen.
Okay. When you were talking about, the 3 months, it was great, and then 6 months it kind of went back. In my mind popped up kind of like the yo-yo diet where people kind of go up and down, up and down. But is that kind of hard on your body too, those variables? Is there any negative impact in terms of the swing of that?
I think it's very different from the yo-yo diet, which affects your metabolism and has a lot of different mechanisms. But the cells are there to replace what's not there anymore. So,
okay.
So it's like hormone replacement, right? If you stop hormone replacement, so instead of giving you all these benefits, then you just don't have the benefits anymore. It's not like the replacing what your body needed is going to hurt you. So it's incremental. So if you withdraw it, then your body just go back to where the trajectory it was going to go on.
Okay.
Anyhow.
Okay. Good clarification there. And then you had mentioned, being able to check kind of the amyloid plaque. There's been a lot of controversy over is that the magic bullet that we should be targeting, with dementia? What are your thoughts on that?
Yeah, I think it's very much likely, a marker, just like, somebody was saying, if you always look for the presence of things, what about, whenever there's fire, there's always likely to be firefighters. So do the firefighters cause the fire? So that's, could be a good analogy for this, but it can certainly be a marker, right? And maybe when there's less firefighters, the fire's gone. So
Gotcha.
So, yeah.
Yeah, there's just so many unknowns, and there's so many variables in the various diseases that fall under dementia. The symptoms, they overlap, and yet they can be so distinct as well. And so it is really confusing for the general public, and I'm sure the medical field and researchers at large, to try to figure this all out. Now, for you, I wanted to see if you had any maybe stories you could share, without identifying a patient, in terms of stem cell use and what kind of experience they had.
Yeah. So, I haven't did that many Alzheimer's patients, but definitely had some success, and I've also quite a number of doctors who also have, some successes with Alzheimer's patients. So just one example, I saw this lady, she was in her 60s, but had severe, Alzheimer's, and to the point where she wasn't recognizing her husband who brought her in, and she was telling me that she wanted to marry me. It was just like, this is a 60-year-old lady, right? So she was very much, her personality and her cognition was very much, very poor. And she had not been able to feed herself for 2 months. She would just sit there, stare at the food. So after the stem cell treatment, she was pretty tired, slept a lot. Next day she woke up, and then she had a plate of food in front of her, and she just picked up a knife and fork and just ate it. This is after not being able to feed herself for 2 months. So, to me, this shows the quick anti-inflammatory action of the cells, because I think, I talk about there's 3 stages of healing in stem cell therapy. The first stage is anti-inflammatory action, which can be very fast. And, my thoughts on this is that when there's a lot of inflammation, there's swelling, there's, blockages of signals that can be transmitted between cells. So all of a sudden, you're calming that inflammation, and the cells can communicate. So maybe there's thoughts that I'm hungry, and the thought that I can pick up a knife and fork and eat and feed myself. And somehow this thought went through. So that was pretty interesting, pretty drastic. The husband was thrilled, and he couldn't believe it. And then I remember there's another case, a doctor was telling me how he was treating.
It's time to rethink, renew, and reimagine retirement. Hey everybody, Jared Sylvester here, host of Retire Repurposed. Now, this podcast is about the non-financial parts of retirement, which many times can be even more challenging than the financial. We believe retirement is not the end, rather the beginning of what could be the most impactful, purposeful, and fulfilling season of a person's life. So don't retire, become repurposed. To listen now, search Retire Repurposed on your favorite podcast platform, Senior Resource, or Life Audio.